Have you ever wondered about the role of vitamin B12 during pregnancy and its influence on infant growth and development? For the uninitiated, vitamin B12 is a crucial nutrient for the healthy growth and development of infants. However, it's disheartening to observe that in many low-income and middle-income countries, a significant portion of the population suffers from low and marginal vitamin B12 status, a condition that could potentially impair their children's development. This brings us to a compelling study which was designed with a specific goal in mind: to measure the effects of vitamin B12 supplementation from early pregnancy until 6 months postpartum on infant growth and neurodevelopment. This study is not just a simple exploration of the impact of a single vitamin, but rather a deep dive into the potential benefits of vitamin B12 supplementation during a crucial period in a child's development. This study may provide valuable insights into the potential benefits of vitamin B12 supplementation during pregnancy. Let's delve into the details of this fascinating study. The researchers embarked on a community-based, double-blind, placebo-controlled trial. The participants? 800 pregnant women aged between 20 and 40 years, all of whom were up to 15 weeks pregnant. These women, hailing from Nepal, were selected through home visits and outpatient departments at 3 local hospitals. The women were divided equally into 2 groups. One group received a daily supplement of 50 micrograms of oral vitamin B12, while the other group was given a placebo. This supplementation carried on from the early stages of pregnancy until 6 months after the women had given birth. It's worth noting that this process was entirely randomized, ensuring a fair and unbiased assignment. So, what were the researchers looking out for? The primary outcomes were twofold. First, they assessed the length for age Z-score at age 12 months. This score is essentially a measure of a child's growth compared to a standard reference population. The second primary outcome was the cognitive composite score of the Bayley scales of infant and toddler development, measured at both 6 and 12 months. This scale is a widely recognized tool for measuring early childhood development. In addition to these, the researchers also monitored secondary outcomes, including any adverse events, to ensure the safety and well-being of all participants. After rigorous data collection and analysis, the results were ready to be interpreted. The results of this study might surprise you. Out of the 800 pregnant women who participated, a whopping 71% showed signs of low or marginal vitamin B12 status. However, even with this deficiency, the supplementation of vitamin B12 from early pregnancy until 6 months postpartum showed no effect on the primary outcomes. Specifically, the mean length for age Z-score, a measure of infant growth, showed little difference between the vitamin B12 and the placebo group. Similarly, the cognitive composite score, which evaluates infant and toddler development, also showed no significant difference between the 2 groups. Interestingly, this lack of effect was observed even though the supplementation substantially improved the vitamin B12 status of the participating women. This leads us to a rather unexpected conclusion. Despite the prevalent vitamin B12 deficiency in the study population, supplementation did not improve infant growth or neurodevelopment. So, what can we conclude from this study? The research clearly shows that despite the prevalence of vitamin B12 deficiency among the study group, supplementation from early pregnancy did not show significant improvement in infant growth or neurodevelopment. The outcomes remained largely unchanged, irrespective of the supplementation. This reinforces the current stance of the World Health Organization, implying that routine vitamin B12 supplementation during pregnancy may not be necessary. In conclusion, this study supports the current WHO recommendations of no routine vitamin B12 supplementation during pregnancy.